Hi, I'm Bill Coase from Blanchard Valley Health System, which is in Northwest Ohio, Findlay area. We have been looking about the changes that are occurring in healthcare over the last several years. Contextually, one of the problems is obviously high healthcare cost. We also see that the alignment of incentives has not been good. And so working with our medical staff and our Board of Trustees, there have been several different issues that we've tried to attack. We started with our mission. What are we there for? What's our purpose? And we define that as ideal patient care, and from that we make lots of different decisions. Our strategic planning process here, related to these specific healthcare reform issues, set up 3 key strategic objectives, one of which was physician incentives or physician alignment, whichever term you'd like to use. Things that we've talked about doing, and we've had a project for the past 3 years with medical homes. We've looked about accountable care organizations and really think the idea of accountable care is important, but we probably won't be doing, at least as a small independent hospital, independent care or an accountable care organization. We're looking at co-management agreements. We're doing anything we can to align physicians, and that alignment has to be from a financial perspective. Second alternative key strategic objective we're looking at is the institution of electronic medical records. We're a little behind some of the other hospitals, but we have been working again with the medical staff and really all of our providers to talk about the different decisions and opportunities that we have with having an electronic medical record. We're really blessed where we are, as we only have 1 medical staff and there's really only 1 hospital, so it makes us a little easier to align those things. And then the third thing, and probably the biggest, of which are part of the first 2, is value-based purchasing. So we have been on a journey for a long time. I like to think we're a Baldrige type of an organization of where we've tried to increase the numerator, increasing quality, making sure our service excellence HCAHPS scores have improved, in addition to patient safety issues and making access to our community all that more important as we look at the denominator, the cost factor of what can we do to reduce redundancies, variations, and things like that. We've got an active program where we've gotten down to the granular level where we can go in with our core measures and the different metrics that we're being looked at to be able to explain and to also show physicians and other providers about what that's going to cost us and cost the community. One of the biggest things that we've done as an organization is try to reach out to the community. We see ourselves as part of infrastructure. We're really not there as a profit maker. We're obviously a nonprofit organization. But in addition, for us to keep businesses, for us to be able to do things in our community and to attract businesses and keep them, it's important for us to keep our costs down. So we've got several active projects where we sit down with not only our community businesses, but with our public officials, with our government, and in addition to insurance companies to talk about several of the different things that we can do in partnership to improve that value-based quotient. Our biggest focus right now is getting a physician integration strategy. I'm an internist. I've been in the hospital system for 37 years, now over on the dark side. I'm in administration. We've got really good collegial relationships with our medical staff. They're just overwhelmed by all of these changes and what's going to happen, not only with their incentives, they've invested money, they have big loans, there are lots of different issues that we need to come up with some commonality. Developing physician leadership is probably as big as anything. But bottom line, we need to come up in our local environment what's the best thing for everyone, and physicians are a big part of that. We have tried lots of different educational opportunities for not only physicians and our internal providers, but also to the community at large. Right now, it sounds kind of small, but we're doing a project on working with antibiotic usage, why we don't need to have people on antibiotics. It's somewhat of a cost savings, but it also has to do with the resistance of different organisms. One of the other things we're doing is reaching out to our behavioral health. That's a real problem. It's a problem everywhere, but especially for us is having a primary care physician that can take care of those problems. And I would say the The key thing right now for our evaluation is coming up with as our CEO would like to say, a world-class primary care project. With decreasing reimbursements, difficulty in running small practices, we need to come up with some kind of a viable alternative that's going to help us in the long term. The question about patient-centric, it's really easy to talk about. It's simple, but it's not easy to implement because all of us look at things from our own vantage point. So what we have done is, one of our values as an organization is education. And I'd like to think we do a pretty good job of that, about discharge instructions on a granular level. However, when you're talking about the community, we have attempted to get together with the businesses and with public health. A lot of us are on different community forum objectives to try to improve healthcare. We've actively engaged with our local communication networks, the radio, as well as with the newspaper. There are a lot of different articles that have been written where we go about trying to explain some of these issues. What I would say, as much as anything related to healthcare reform, is somewhere the patient has to become more involved. And then the patient is also the family, whether we're talking about end-of-life issues, whether we're talking about when you go to the emergency room, when you use a generic drug. And so our focus has been on those things through ethics committees, through outreach, and even through our marketing and public relations departments.
Hello, I'm Chris Stadles. I'm President and Chief Executive Officer of St. Francis Hospital and Medical Center in Hartford, Connecticut. And I've been asked to comment about healthcare reform and how our organization is addressing healthcare reform. This day and age, there's a great opportunity in this country. Healthcare is significantly broken, and I think everyone is finally understanding that that's the case, and are organizing ourselves in this whole reform initiative to change our organizations from volume-based organizations to value-based organizations, to manage populations of patients across the continuum, and to not be hospital-centric any longer, to not focus on hospitals telling the community what they need, but understanding what the community needs and developing initiatives to do that, and which is very, very important. So we're taking that to the next step. Over the past number of years, we've been aligning ourselves with our medical staffs, because you can't accomplish this without being joined at the hip with your medical staffs. We've been implementing information technology very aggressively because, again, how can you manage populations of patients if you don't have the information technology and the information to understand what the needs of the community are and develop programming to accommodate that. We're aggressively attacking equity in care and the disparities that are out there very formally in our organization, and we're really proud of all these initiatives. Right now, we're spending hours and hours with our physicians to develop a structure for accountable care. Right now, coming from the government, everyone is kind of cringing when we talk about accountable care organizations, because the first regulations from CMS really put hospitals at risk. However, that didn't really push us away from the whole concept of accountable care. We need accountable care organizations, and we've been putting together an infrastructure where we're trying to address each and every one of the things that we think are important. How are we going to be paid? How are we going to deliver the care? How are we going to communicate with our communities and our patients to understand what their needs are? And so I think that's really the most important immediate initiative that we have at this point. St. Francis is adapting by really trying to understand what that changing landscape is. It seems like every day there's something new. We need to understand that in order to really meet all these challenges, there are two major things that we're really looking at: what the cost of the care is and the quality. Our cost of care, we have to be able to live within Medicare payments. We have to be able to live within the parameters of the financing currently in order to transform ourselves to that next curve that we have to jump. We have to have the highest quality possible, so we're really providing the value to our community. So we're spending a lot of time in that regard and focusing on quality and understanding the cost structure. So everything around that we're trying to adapt to, and it's a real challenge, but there are great opportunities in that. The community communication is probably the toughest thing because the community may not even understand all the issues surrounding healthcare reform, and so we're trying to do a lot of different innovative things. I have a special kind of newspaper byline that I put in to our local newspaper on a maybe every 2-week period where we're commenting on the different issues around healthcare reform and trying to educate the community. We're bringing community into a lot of our initiatives to discuss how we can better improve the quality of the patient care in our organization. We're just trying to open up every single kind of dialogue that we can with our community. There's so many people to reach that, you know, we're still skeptical that we're really doing a good job at that, but we're just scratching the surface, but we need to find other ways, and we really don't have a great answer to that, but we're trying very hard to get that message out.